What are some of the early conversations you're having with some of the, some of your nursing leaders out there in those sites?
Yeah, I was lucky enough to be in New Hampshire in
Okay.
January for the go live. I spent the first week there. And as with any, I've been through multiple EHR implementations over the last 20 years. And I will have to say, there was a lot of excitement. Change is always tough. And they saw with, the training that they went through, the ease of use. Even I went through much of it, but I was by no means an expert, even though I was out there wearing that red coat, like, hey, I'm going to help you all. Everybody had red vests on that were those super users. And I hadn't utilized the handheld application. Day 2, I was looking around thinking, I haven't seen anybody give any meds using their smartphones. And so I went up to a nurse in the ED and I said, hey, how about we try out scanning meds with your phone? And she's like, what did you just say? Because it was a lot to educate not only the desktop, but the handhelds. And so thought, this is a great opportunity.
Sure.
Young nurse, she's like, let's do it. And I'm thinking to myself, gosh, I haven't even, it's been a while since I've tried it. Okay, she grabs her medication. We go in there. She signs in to the app. It was so easy to use. And you'd think in a stressful situation, she scanned her meds. All the checks were in there. She's like, oh my gosh, this is so exciting. I can't even tell you how much time this is going to save me. That ability where, to give that medication, to be able to document. And then as I walked around the different nursing units and told them, hey, did you know you could give meds, you could do your full documentation? I had one nurse, he said, you can't even see this tear. I've got this tear coming down my eye. He goes, you have made my day. You would have thought it was Christmas and they all got new cars. The amount of time that it was going to save them. Our respiratory therapists who many times, if they didn't have their computer on wheels and trying to find that device, whether it's in the room or not, you have that smartphone in your pocket, right? That you're not putting down, that you're utilizing. And so that was one of the biggest, and just the ease of use. So MEDITECH did a great job. They didn't even have to go through the training in order to be able to use that.